So, are you a good teacher? To what extent is your teaching ability part of your role as an OT?
Yes, I'm the best teacher ever. Yeah. I think I'm a good teacher. I mean, I think there's obviously people have room for improvement anywhere, you know, and try to change up things every year in response to like the IDEAs and the end of the year surveys or student comments to me or things like that. I mean, I definitely try to change, but I see my role as not only just being a teacher but of skills and OT, but also a teacher of professional behavior and that sort of thing. So as being my students, you know that my classes are run pretty much like it's your job. You show up on time, you do what you need to do, and that sort of thing. So I think every moment and every interaction I have with students is a teachable moment, and I think that that's important to know too. And because I teach second year students, I think my role is a little different from faculty who teach only first year students. You guys are going out into the clinic, so at some point in time I need to cut the ties during the semester. And you know, when you guys are all coming at me like, help me, and I say, no, 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 you know, you get mad about it, but it's necessary. There's a point in time where the ties need to be cut because you need to be able to do that out in the clinic. So
Do you think that, like, how would you describe, like, the teaching role in terms of, like, with a patient, not, like, a professor?
yeah, I mean, it's a little different with patients. Sometimes it depends on who the patient is, what skills they bring, if they cognitively intact or cognitively not intact. I mean, it's just like teaching students. To be honest with you, there's some students in class who pick things up quickly, and there's some students who don't, and you have to kind of adjust and make sure that everybody is learning. Easier with patients because in my current role I see them one-on-one, so I can spend one-on-one time with them. If I'm seeing 2 or 3 patients at a time in a different clinical setting, I might have one that picks it up really quickly and someone who doesn't. So I need to kind of taper how I present the information to them. And I really try to get them best on what they feel like is their best way to learn. Most people, combination of visualizing, so showing them the activity, and then also verbal. Some people you can just say things verbally and they get it, but for the most part it's usually showing them and talking at the same time. That multisensory type of treatment.